Hello, and thank you for joining us for today's session on technology innovations, looking forward, workforce efficiencies, and client experience. The webinar is part of our Lutheran Services in America Strength and Service series, in which today we're highlighting for all service lines and sectors how connected care teams and integrated services and supports can benefit your organizations. Today, we're going to hear from three of our most innovative Lutheran Services in America members, as they talk about how they've reimagined their business, taking advantage of technology to create workforce efficiencies and improve client services. And given the workforce shortages that we all face today and expect to face in the future, this is a very timely topic for all of us. I'd like to thank Simply Connect for their support of today's session, as well as their partnership throughout the year and their support of our three members who are here with us today. They're a terrific partner for all of our organizations. Thank you, Craig and team. Now I'd like to turn it over and introduce our guest facilitator and moderator, Shalita Bundridge, who's an Emmy Award-winning reporter and community advocate. She will be moderating the session today. Take it away, Shalita.
It is such an honor, and we are so delighted to have you here. The reason that I am here is because my father-in-law was 83 years old, and he lived in Ohio, right outside of Cleveland. My family is based in Minnesota, and when it was time for him to go into assisted living, we put him somewhere where he'd be close to his friends in Ohio, where he lived and grew up. But it became difficult for us because we were his, power of attorney. We managed his care. We were the ones who were responsible for making sure that he was okay. And we did not have a line of sight on what was going on. We are in Minnesota, my husband and my 4 children and I, and we kept having to go back and forth to Ohio to figure out what was going on, why his medications were making him behave this way, if there was an issue, if we needed to talk to the doctors. And it became so difficult that we just packed him up and moved him in the house with us. We didn't have something called Simply Connect to help us speak to the entire care team so that we could interact with the doctors. It wasn't efficient. It didn't work out for the families. And, that is what's going on in the country right now. The people who are responsible for their elderly loved ones, 9 times out of 10 are not living in that state. And so what Simply Connect does is it bridges a gap. It makes it easier for families, and it also helps you with your workflow. We're going to tell you all about that today in this workshop. Now, we've got some amazing people. Some of them are new to Simply Connect, and they're going to tell you how it is revolutionizing what they are doing. Some of them have been with Simply Connect from the very beginning, and they've got data to show you that this program, it really works. So we're going to be talking to Matthew Kern. He is a Chief Operating Officer at Cassia. Brenda Leiker, she is the Regional Director at Cassia. Dave Summerall, he's the Vice President of Sales and Marketing at Cassia. Kate Hutchinson is going to be here with us. She is the Deputy Director of Lutheran Social Services in Northern California. Amanda Schroeder, she is the Vice President of Home and Community-Based Services at Jenna Cross, and I was so happy she was here. I called her this morning and we've been talking all day, so y'all are going to really enjoy her. And Charlotte is here with us. She is the CEO of Lutheran Services in America. Now, you all do not want to go anywhere. Okay, I know how you like to drop off these calls, get you some lunch and go back to work, but don't do that, because the CEO of Simply Connect, Craig Patnote, is going to be the last person presenting today. And I wasn't supposed to tell y'all this, okay? This is top secret. But he has got a very special offer at the end of this 1-hour seminar, workshop, virtual meet and greet, whatever you want to call it, that you do not want to miss out on. So don't go anywhere because you don't want to hear about it. You want to be here for it. Now, the first folks that we are going to talk to are Dave Summerall and Brenda Leiker. Dave, again, is the Vice President of Sales and Marketing at Cassia, and Brenda is a Regional Director. And Cassia recently started with using Simply Connect, and they work primarily in assisted living. But you know what? What they do is folks like me. They make it easier for families to care for their elderly loved ones. So I'm going to let them take it away and tell you all about how Simply Connect has helped their program.
Great, thanks you, Shalita. Again, my name is Dave Samro, the VP of Marketing for Cassia. I'll be doing the majority of the presentation, and then towards the end of the presentation, Brenda Leiker, who's really our project manager working with Simply Connect, is going to talk about the actual digital lease signing. That's something that we're most recently are rolling out, and so Brenda is going to talk about that as well. So again, it's very good to be here. We are very excited to talk about Simply Connect and our, even though it's been a short period of time, our experience with the platform and the product. Next slide, please. So with Simply Connect, and you have to understand Cassia. Cassia, the senior leadership team is made up of, I'm 60 years old, and they're folks probably about the same age within Cassia. So we're pretty old school. And when we talked about, when Craig Patnode presented Simply Connect in the platform, it was like kind of like vapor out there, kind of a mist in the air. And so we talked to Craig, and we said, I think the best place to start is creating that digital lease and that move-in packet, something that we could touch, something that we could experience a change in. And so that's where we started with Simply Connect. And so what we did is we're in the process of, and I think we have our first live digital lease signing this week, which is very exciting. But to create the digital lease and move-in packet, we wanted a resident and family-centered process that really made the process easier for our residents and families. As Shalita had talked about, adult children, and I'm going to talk about my parents who live in Texas. And that's a common situation for our seniors who live and move into our communities, is their loved ones don't live close by. Simply Connect, especially Courtney, really helped us organize our move-in documents. We were still in the midst of a merger, and that merger was interrupted by COVID. And so Courtney just really rolled up her sleeves and helped us organize and standardize our move-in documents across two organizations that were merging. And of course, improved workflow and staff efficiency. The family and power of attorney had access, so we'll have access to the Simply Connect platform. The embedded e-sign, which is fantastic and a huge time saver. And then Craig is going to talk about just reinforcing the Cassia brand upon inquiry. So wouldn't it be a beautiful thing if you had an inquiry that was looking at your one of your communities, and you could, via the phone or the Simply Connect platform, send them an email or send them a text, excuse me, or an email, just introducing, if you move into this community, a Cassia community, this is who your care team will be. So even before they start the move-in process or the lease signing process, just being able to introduce a care team in Cassia to a prospect is extremely powerful. So the digital lease sign move-in packet is really a phase one, and it's a gateway to phase two, which Craig is going to talk about, the full Simply Connect platform. Next slide, please. So Craig Patnode really had to push us. You know, we're healthcare providers, and we love paper. The more paper, the better. And I think paper is comforting for us to have a lot of paper in healthcare. So Craig really had to push us to become the Jetsons. And Craig didn't say this to us, but in our minds we were thinking, are we going to be the Flintstones or are we going to be the Jetsons? And we really wanted to be the Jetsons. We didn't need to print the internet like you've seen in the progressive ads. Even though tempting, we just we had to let go, and we're still working on this. It's a process. We're still working on letting go of paper because we really like paper. And so Craig has really, Craig and the team has really pushed us out of the paper jail, if you will. Next slide, please. So just to give you an overview of Cassia, and I think when Craig saw this, he probably started salivating because we have an entire care system within Cassia. And the care options, so our core business is, of course, independent living, assisted living, memory care. But we have all these ancillary services, pharmacy and home care and hospice, on-site physicians called Genevieve, a medical supply company, therapy company, and we have very strong relationships with our healthcare systems within Minnesota, and Alina being one of those healthcare systems. So here we had all this bricks and mortar, and we did okay communicating, but Simply Connect will help take us to the next level. The next slide, please. And what we call that is our circle of care. Sometimes some of the folks call it a warm blanket, and that's the term I like. Just having a warm blanket. If we have a resident who moves into one of our communities, that they have access to this full continuum of care, whether it be pharmacy or home care, on-site physician or adult day, and just that warm blanket of care is what we like to call it. But we really needed to streamline the communications for staff, residents, and families because it was, and we understand it was very disjointed. And then also, and I think Craig will talk about this as well, is we really had to increase our internal referrals. We knew, and I don't like this term, but we knew there was leakage within the organization, and there still is. And so we're excited to move to the next step with Simply Connect to really easily increase our internal referrals between our core business and home care and hospice or A&E pharmacy or short-term rehab or open circle adult day. And it's going to be a very good tool for us to increase our referrals internally. Next slide, please. So the aspirational vision, as I've said, is, and we're just getting started, it's been only a few months with Simply Connect, but our aspirational vision is to just better patient care, period. And we know that eliminating duplication and paper and going paperless will provide staff to have more time to provide to their patients and to their residents. And then just really immediately connect care teams, families, and support systems to provide quality care through a paperless integrated system. So when we looked at, where do we want to go with Simply Connect? These are the words that we came up with, and this is our aspirational vision to get there. Next slide, please. So, and I think we can all identify with this. We all have, this is one of our heroes, and we all have staffing heroes within our communities. And at Cassia, we have a number of people who have been here for 20, 30 years. But honestly, and this is Julie. Julie's been here for 34 years. But post-COVID, even pre-COVID, our caregivers are stressed. And even though we support them, I think sometimes they feel like they're a hamster on the wheel, just trying to get through the day. We fully understand that I think it's easy to recruit people, but to retain people can be difficult. And so our employees expect innovation to make their job easier. In fact, at Cassia, we've had a number of employees actually who have left Cassia, but they've come back because the innovation, the technology, the ease of work wasn't what they expected at another senior care provider. Understanding that technology can really help us in this staffing crisis. And we've seen the results of that, and I think we will continue to do that. So just hanging on to our heroes like Julie, who have been here for years, or even those that have been here just a couple of years. We want to retain people, and we know technology is a vehicle to do that. Next slide, please. So I'm going to talk about my parents. So these are my parents, Forrest and Joe Samro. They live in Austin, Texas, at a senior living community in Austin. And as Shalita said, we would have loved to have Simply Connect because I live in Minnesota. My other sisters live in Minnesota as well. And just to have it, as Shalita said, we just felt disconnected. And the communication with family members was very disjointed. So they live in Austin, and because I'm in the business, so to speak, I had to fly to Austin to work through the lease with the property that they live at. And it would have been so much easier just to, even though I love visiting my parents, don't get me wrong, it would have been a lot easier just to do a digital lease signing. And then also through their care, I mean, they're 90 years old, they're in relatively good health, but their care plans are constantly changing. And so I feel bad for my sister who lives in Austin, and she's taken on the burden of trying to keep all this information current and collected and communicating with other family members who do not live in Austin, Texas. So our current communication is, we're using text. Sometimes we use Facebook. Sometimes we use FaceTime. Some of the family members are on FaceTime or Facebook, and some of the family members are not. So it would have been fantastic to have a single communication platform, not only for families, but for physicians and care providers, where we could communicate and keep updated on our parents. So with that, I would like to introduce you to Brenda Leiker. Brenda has been the project manager for Simply Connect. And as I mentioned, even though we're still in the beginning stages, we have there have been a lot of heavy lifting that Brenda has done to get us where we're at. And she's going to talk a little bit about the digital lease signing. So with that, I'll turn it over to Brenda.
Great. Good afternoon, everyone. Our goals at Cassia with Simply Connect right now are quite simple. We want to spend less time shuffling through those papers and getting signatures when residents are moving into our communities, and spend more time with our residents and caring for our residents. We have a mantra of being paper-free by 2023, so that certainly feeds into this goal as well. We want to be able to easily identify if we missed something during the move-in process or the lease signing process, and have a way to resolve that using Simply Connect, and we'll be able to do that using Simply Connect. And we want to help our residents and their families become more familiar with electronically signing paperwork, in the hopes that we can use those signature features more broadly in the future, once we get a move-in process more solidly in place. As Dave mentioned, it's been quite a project for us so far, just to get our move-in paperwork or our lease paperwork standardized for our communities. We had a merger, and then we had a pandemic, and so that has certainly created some issues, but we've got that worked through now. And we're really excited. We have our first move-in that will be electronically or digitally signing paperwork on Thursday at one of our sites. So we're really excited about that. And we'll get this phase rolled out, and hope to further build our care teams and more fully utilize the features of Simply Connect then moving forward, once we get this first phase completed.
Great, thank you. Okay, Shaletta, we can turn it over to the next speaker.
I had a couple of questions, and I want to make sure we don't miss anything in the chat. It was so good. People are saying it was so good to see your parents, and I can identify with that because, when my father-in-law was, all the way in Ohio, and I was in Minnesota, my husband would have to fly back and forth if there was an incident or something needed to be signed or decisions needed to be made. And, especially when he was moving in. There's some signatures that had to be wet. We couldn't send it in. They had to see it. It had to be notarized. And so talk to me, Dave, about how Simply Connect is helping to streamline that process.
Yeah, and I'm going to probably lean on Brenda to answer some of that question. But just as you said, we have many family members, especially at our, destination location sites. We have sites in Florida and also Colorado, where our seniors live, but their family members, of course, do not live in those areas, those destination areas. And so we have a number of families who just don't live close by, and understanding that this is will be a huge benefit for those families who do not live in the same town as their loved one. And then of course, hopefully there's not another pandemic, but if there is, or a flu outbreak, if you will, we see Simply Connect as another tool. If we're discouraging people from coming to any of our sites, this is an easy way for us to get the work done that we need to get done, and just a very efficient way. And also at Cassia, we talk a lot about innovation, and we talk a lot about it. And then we have residents or families come in, and then we ask them to sign piles of paperwork. Well, that's not very innovative. It doesn't match up what we're saying.
You're killing all the trees, Dave. All of them. You're
right,
killing
exactly.
all the trees.
Exactly. So this is in step with our vision and our strategic plan, is to use Simply Connect and the e-sign platform.
Well, thank you, Dave and Brenda, so much. And we want you to remember that Simply Connect is a patient-centered, paperless healthcare, and it is simple and easy to use. And that's why Dave and Brenda over at Cassia are excited about having it, excited about it, not only helping their patients and their families, but the staff as well. Thank you both so much. And next, we're going to be talking to Kate Hutchinson. She's the second person on this panel today. She's with Lutheran Services of Northern California. And Kate has been using Simply Connect for a couple of months, another newbie, but it's already revolutionizing the way that she helps the homeless community. Kate, thank you so much for being here. And I want you to talk to us today about how Simply Connect is helping Lutheran Social Services and the program that you have to end homelessness there.
Okay, thank you so much. It's wonderful to be here today with you. Lutheran Social Services of Northern California provides housing and supportive services to people who are experiencing homelessness. We serve over 4,000 people. Those could be seniors, families, moms with kids, single adults, or transition age youth. We serve 4,000 annually. We have 38 programs across 8 counties. And for those of you who aren't as familiar with California, that goes from about the middle of the state up to the Oregon border. So in California, because we are the leader in so many things, we have, our state has converted their Medi-Cal program, Medicare program, into what is being called Cal-AIM. And this is a way from Medi-Cal to serve people who are experiencing homelessness. This is a brand new project. It's new for the state, it's new for the health insurance providers, and it's new for all of the services providers. As part of Cal-AIM, health insurance providers are required to partner with agencies like Lutheran Social Services to provide services to people who are homeless. This program was implemented in January, and this was our opportunity to really implement Simply Connect. And you can see the picture, all the pictures that are on these slides are of our clients, and they've given us permission to talk a little bit about them and their stories. One of the things that we love to do when we house people is to take a picture of our clients holding their keys. So this is a picture of one of our move-ins. Okay, you can go to the next slide. So building on the work of Jenna Cross, we started working with Simply Connect back in January. It helps us to marry medical model assessments, closed loop referrals, and care plans that are already contained in the software. And by the way, many of these things were a new language for us. It helps us to marry it with the social rehabilitation services that we use to serve people who are experiencing homelessness. As a new Medi-Cal provider, having the framework provided by Simply Connect really facilitated our staff's learning and understanding about how to not just provide the services, but then to move to that paperless documentation. Move ahead. Oh, sorry, I should tell you the story about this person. So this is one of our clients coming into his first apartment. He was so emotional when he moved into this apartment because he'd been living in his car for the last 7 years. So you can see his outstretched arms saying, "This is all for me." That was a good day for us at LSS. Okay, next slide. And I'll tell you the story first so I don't forget, because it's one of my favorite pictures. This is one of our senior clients who kicked off her shoes and she's jumping for joy because she just moved into her new apartment. So we have several partners. The key partners are the healthcare plans that have newly contracted with LSS. That includes Anthem, Blue Cross, Molina, HealthNet, and then we're taking on new partners as this program starts to expand across the state. Our other major partner is our staff. So training them in how to use Simply Connect, the ease of data, that this is accessible on multiple devices. So you can have the platform on your phone, on a tablet or your laptop. And that makes it very easy for data entry. For the future, what we have not done yet is integrate our clients and our healthcare plan partners onto this platform. So we have a goal to do that in the next months moving forward. So we've had some challenges, including adapting the software that was developed by Simply Connect and perfected by Jenacross to really meet the needs of the CalAIM program. So Simply Connect has been really wonderful with us in terms of really making all the changes that we required to make sure that it meets the needs of this new Medi-Cal program. Another challenge was getting staff up to speed so that they feel confident and expert in navigating the program. And I think that's just a matter of time, but all the feedback that I've received from staff is that it's a very simple, easy program to learn. Developing our workflows, okay, we're still knee deep in that. So the workflows are partly go everywhere from the point in time when the client is referred to the first intakes and assessments, into providing regular services. There are a lot of stops along the way with workflows. So that's our project for the next month. And then finally expanding our care team to include all of the family members, the ancillary care providers, and the doctor, which we hope to do by the fall. And this picture is of one of our gentlemen holding up his lease. He came to us directly from a homeless shelter, and his smile tells the story. Very happy to be housed. So that is what I have. Thank you so much for your time, and happy to answer any questions.
Yes, thank you so much, Kate. One of the questions that came in was from Miss Patricia, and she wants to know, a lot of people, especially families, have not been introduced to digital signatures. What are you all doing, Kate, to help familiarize people and put them at ease when you start talking about using digital signatures?
So a lot of our job overall is engagement of the people that we serve and their family members, and really teaching and training them about how this works. And digital signatures can be daunting for people who have not done it before, and so we practice.
And one of the things that you talked about in your presentation that I found very interesting, and I'm sure a lot of people will agree, is, training the staff. Our staff always talks about how strapped they are for time, and they've got, so much to do. Did you find any resistance, like, oh my God, this is just one more thing I got to learn how to do on top of everything else I got to do? Or did they understand the value in Simply Connect and say, you know what, if it's paperless, it's going to streamline my workflow. It's going to help me do more with less. Let's go, let's get it done. What was the reaction from staff when you introduced them to Simply Connect?
Well, Shaletta, it runs the gamut, just like you explained. Some people are like, oh no, one more thing. And other people are like, let's go. What we found is that once they started interacting with the platform, they were really excited to use it. It's very easy. It's very intuitive, especially once they realized they could bring their laptop or tablet while they're meeting a client, do their notes right there on site. People have been really excited and have adapted to using it very well. Although we still have some people who will take written notes and they transfer them into the computer. We'll have that fixed soon.
Everyone's looking for workers. Do you see Simply Connect as a tool to help recruit workers, where you can see it as a benefit to say, hey, listen, we've got this paperless way of doing healthcare. You don't have to take all these notes. You don't have to have this paper file. This is how we do things over here.
Well, it is, and we mention it in our interviews for our staff. I think that sometimes when staff hear that we're using Medi-Cal, there's like a feeling of like, oh my gosh, it was going to be so much paperwork. But when we explain that we have it streamlined through Simply Connect, and it's a very easy process and easy to convert your client visits into billable time, that eases all of their concerns.
And you keep using the word easy. You keep saying easy, easy, easy. And, you know, that's the one thing we keep hearing over and over again from people who have implemented Simply Connect. And so talk to me about what was the one thing that you say, oh my God, this has made it so easy. If you had to look back on the one thing that was, you know, just kind of a handful to do, and Simply Connect came in and made it easier for you and your team.
Well, one thing we love is that when we do the assessment converts into a care plan. So you don't have to write your own care plan. It all happens when you do the assessment, you do the thorough assessment. We are following in the footsteps of Jenacross. So excited to hear that they got their assessments down to 30 minutes. So we have a new goal. Yeah, that's one of the things that makes life very easy.
Well, thank you so much, Kate. Kate Hutchinson has been joining us from Lutheran Services of Northern California, been using Simply Connect for the past couple of months and already talking about the ease of putting together care plans and how it's streamlining the workforce and helping the families as well as their clients get the work done. Thank you so much, Kate.
Thank you,
and now we have been waiting to talk to these folks. Kate's waiting, I'm waiting. Jenacross is here, honey, because they were there from the very beginning. Amanda Schroeder is here, and Amanda and I were talking this morning. I said, call me, girl, because I got to hear about what is going on. Now, y'all been hearing everybody talk about like, oh my God, Simply Connect is so easy. And, you know, the families are getting connected. It's a paperless way of doing healthcare. You can get all the information on your phone. You don't have to travel all the way back to Ohio from Minnesota so that you can sign the move-in paperwork. You know, those personal stories, they mean a lot. But I know you want your data. I know y'all are big on data. You like to see the charts and the graphs. And that's what Amanda Schroeder with Jenacross has for us today. She's talking about, you know, how they, you know, had one person leave because of attrition, right? And still, we're able to get the same amount of work done. And that's because of what Simply Connect provides. And so Amanda, I'm going to let you talk about Simply Connect, how it has helped Jenacross simplify the staff workflow, get those encrypted messages done. You all are using it with affordable housing, and I'm going to let you take it away from here.
Sure. Well, thank you. And as everyone has said, Simply Connect is great. You're going to hear a little bit more about how it wasn't so easy for us. We were the original pilot site. So we did work with Craig and his team who were great during the process, but we actually helped them build out the assessment tool and service plan and marketplace, everything that we currently have available to us in Simply Connect. So we came across barriers with that, but how we overcame them as well. So if you can go to our next slide, please. So several years ago, actually, several CEOs that were our LSA members came together and started to talk about how they wanted to build a service coordination model, and then essentially go out and talk to payers about it and start to generate additional revenue for the already established service coordination models that many providers were already utilizing, especially in affordable housing. So we started to develop different work groups. We had an assessment work group that I did sit on, and then we really looked at 3 assessment tools, the GAD-7, the PHQ-9, and the Weller-X. We kind of molded them together and built them out with more of a logic model to really help our staff. One thing from an operator standpoint is I hire and train very, very qualified staff members, but they're very, very taxed, as you have heard several times today. So I wanted to give them a tool that helped them think and process, and so they didn't have to be everything to everyone. So we sat as a collaborative work group and developed that out. And then we searched for a platform provider, and that is when we came across Simply Connect and Craig and his team. And I started to implement the model then in February of 2019. And it went fine, but we definitely went through a lot of hurdles with my staff. So if you go to the next slide, I'll start to talk about some of those hurdles that we conquered. So some of the barriers was the staff and resident training. In all great leadership, you just think everyone understands and is right there in your brain with you. But I found out the hard way that my staff were not. So we did implement in February of 2019. We did it more in a lockstep method because we were in a different system and we could not export from that system and then upload into Simply Connect. So we did start with just demographics, rolled it out to our staff, trained them. They had a month to enter in all of their resident demographics. And then we went on and trained in assessments, and then we started doing assessments and then service plans and such month by month. Once we had the system completely trained to the staff, I received a huge pushback, mainly because the staff were not understanding the why, but also it came across because of the assessment tools that we gelled together in the system. It does seem very case management. And a lot of my staff were saying, we're not case managers, we're service coordinators. So I learned the hard way that I had to pull my team back in and really train them on the why. Plus they couldn't explain the why to the residents. So then we were getting a lot of calls from residents and family members asking, why are you asking for copies of my insurance card? What are you doing with them? How does that work? So I needed to pull my staff back in, which made us press the pause button on the implementation, really explain that why. Some of the staff completely got it after that and were able to implement it. A lot of them were pushed back, and we did lose staff along the way. Some of that is not bad though. Attrition is not a bad thing. We were able to then train and really recruit the staff with the expertise that we really needed to catapult this model. Also then, we also received a much more positive response from our residents and our family members. They understood that we were asking for more information and asking similar questions that they might have just been asked in the hospital or nursing facilities, because we were really drilling down into what are those gaps in services and why are they gaps in services? And then we could quickly refer out because we had insurance information, we had emergency contact information. So all of that information that you need to access services quickly. Also, whenever we were having conversation with payers, we learned that we needed to use like language. So whenever we sat in a room with a payer and used service coordination, several of them stared at us like they didn't know what we were talking about or had a different idea of what service coordination was. So really doing your homework and understanding exactly what a payer is looking for. Also knowing the populations that you can or will serve, because once you get a conversation going with a payer, it's like a game of ping pong. They just keep hitting balls at you to see if you can service that population. So you have to really have your mindset on who you can and will serve. And then agree upon outcomes and expectations with the payers. That was something that we learned as well with one payer relationship that we did get in place. Unfortunately, it didn't pan out for us, but understanding the outcomes and expectations that they're looking for. Also understanding those referral processes and workflows and have them consistently established with those payers. Simply Connect does a lot of that for you. But understanding what workflows those payers have in process and knowing exactly how to work with Craig and his team to be able to get Simply Connect to work within their workflows and make their lives easier. Working through the bureaucracy of the payers, this was probably the biggest learning curve that we, as in Genacross, had experienced. We were working with a national payer, and they were on board. We had an agreement in place and started to doing different crosswalks of our system. We actually went as far as to doing resident reconciliations for a couple of months, and we were ready to implement. Now the pandemic did happen, so that did pause everything for them and us until we really wrapped our arms around it. But then whenever we finally circled back a few months later, we then started involving the local payer here in Ohio. That is the branch from the national office. And the local payer had no clue what we were talking about, almost spoke a different language. So that even delayed it even further. We had to do a lot more meetings and really get them to understand our model and what the goal was, even the goal of their national office and why this was so important. And then also, unfortunately, they lost several of their management team from a national perspective, and their focus just diverted. So unfortunately, we never were able to fully implement that model. And then understanding the pain points in the focus area for each payers, really do your research, look at their HEDIS gap scores and where their pain points are and where our model really fits in, or where your expertise is at in your organization and how Simply Connect can help them with that. The next slide, please. So this is accelerators. As Shalita said, I do have data. I probably have more data than I even know what to do with at this point in time. But we are working on really capitalizing on this information and how we utilize it, even if it's just with different LSA members that are starting to establish relationships with payers and what the model can do. But now this is since February of 2019, and this is only until the end of April, because that's when I pulled all of this data. But we had completed a total of 5,789 assessments. We do have a tiered system that we use, and it's just an internal system that we use that kind of captures the frailty of our residents. And we have different contact points built in. So one resident may be assessed multiple times throughout the year. So that's why you see a larger volume of assessments. And the number of residents that have actually been assessed is 1,160. As Kate said, we do have our assessment time down to 35 minutes. Whenever we started, it was close to an hour. One thing that we did do, especially whenever I pulled my staff back in and also listening to my director and my senior level staff implementing the assessment process, is there was a lot of questions and concerns on how do we do this assessment, because it's so time consuming, and they weren't utilizing the logic model that's built into the assessment to their advantage. So what I did is I brought in our skilled nursing facility, or our skilled home health agency. I brought in our RNs, and they trained them on observational assessment skills. And we walked through the assessment tool with mainly my director levels and senior level staff. And then we rolled it out to the rest of my service coordinators to really walk them through how you actually walk with the resident through their apartment, and you're doing assessments from an observational and just day-to-day conversation. You're actually opening up their refrigerator. You're asking them to turn the knobs on their stove, because of it, whenever you identify nutrition insecurity as a gap in service, why is nutrition insecurity a gap in service? Is it because they can't afford the food? Or is it because it's a widow that just lost his wife and she used to do all the cooking? Or is it because he can't see the knobs on the stove and doesn't know when the stove is on or off? So there's a lot of reasons why there could be a gap in service, but really helping my staff to understand those observational assessment skills and then how to complete that assessment. Much like Kate said, we did do a lot of work with Craig and his team, because as my staff was assessing, because it is a large assessment, I wanted to build out that service plan and be able to identify those gaps. So we did build out those triggers with Craig and his team. And as you're assessing, you're building that service plan. So whenever you complete that assessment, you get a full list of all the gaps, and you can actually trigger them to go over into a service plan and complete that service plan. It is nice as well too, because as you're building that service plan, you can make the referrals right out of that service plan too. So we wanted to really build a system. I have a lot of operators and day-to-day staff that have a lot of years of experience, that whenever I sat with them, this was their dream system. So we had an opportunity to build it, and we definitely captured that. Again, I'll just hit on a couple of these, but we did identify 1,526 needs. And we did set 1,170 goals out of those needs that we identified, and we were able to accomplish 1,032 goals out of the goals that we did set. We know for sure that we're going to be able to accomplish every goal or even build a goal for everything that we identify. There's just gaps in our communities. But what we should be doing then is how do we come together as service providers to then hopefully develop services or tap into services that are already out there. So we can use this system and this data in different avenues then. Then it puts the weight back on my shoulders whenever my staff comes to me and says, I don't have anything to refer this resident to, help me out. Or we're continuing to see this transportation gap. What can you do for us? So they really have been pushing back on me on that, which is great. Also, our resident engagement, we have 98% of our residents that are fully engaged in our service coordination, and those residents that typically tell us, no, we do not want to be involved in your service coordination, at one point or another will come back to us and need our help, and that's fine. But right now, our resident engagement is very high, and I think it's because of this model. I know Dave talked about internal referrals. That was also a goal of ours. We're very siloed just because of a large full service continuum of care. And we wanted to really break down those walls, and I seen Simply Connect as that option. Whenever we started using the internal referral services, I only did that internally and did that intentionally. So I was referring to internally for outpatient therapy within Genacross, our skilled home health services, and also our skilled rehab services. And I wanted our staff to get comfortable with only using it internally. Then I built in those external referral sources that we could use electronically as well. So we have, since February of 2019, made 210 internal referrals, whether it's for our outpatient therapy, skilled rehab services, or for skilled home health services as well. My last point that I really want to touch on is supportive leadership to really push this model into operations. You can have all the administrators in the world that you want, but if you don't have that support from the top level, Rick Marshall is our CEO of Genacross, and he came to me whenever he started talking with LSA about this model and really building it. And he came to me, said, I want you to take this on, but then gave me the freedom to do it. Now, from an operator standpoint, I always guaranteed him I'd stay within budget. So I did meet that goal as well. But to have that support from a very high level, also whenever my staff were pushing back, he was always right there to come in behind me to say, no, this is where we're heading as an organization. And politely and professionally always say, if you're not with us, then you have some tough choices to make. So if you really have that supportive leadership, this model will be very, very successful for you. Next slide, please. Factors related to scale. We spoke about several of these already. Really understanding staffing ratios and with the different populations that you can serve. And knowing exactly what that looks like. My staffing ratios compared to Kate's staffing ratios are going to be completely different. So really understanding the need and what that looks like so that you are always focused on your ROI is going to be important. Building in touch points with payers and even internally with your staff and your residents, to making sure that we're always meeting that need, or at least coming as close as possible to meeting that need, is really important. And then also having the bandwidth to expand. One thing that payers always ask us, especially is, if we get this up and running, how quickly could you expand and what does that look like? So really always having that in the back of your mind. And then adapting to meeting any population that they bring to you as well. Next slide, please. And that's it.
Thank you so much, Amanda. And we are going to bring in Craig Patnode. He is the CEO of Simply Connect. As I told you guys at the beginning, I wasn't supposed to tell you this, we're supposed to save it, but I work in news and our job is to tell other people's business. He is going to be offering something very exciting to everyone on this call. So please make sure you stick around. And before I bring Craig in for his presentation, we have a question that can only be answered by you, Craig, from one of the people in the chat. Let me find that. Hold on just a second. I believe it's from... Here we go. All right, Craig, this is what they want to know. Would these tools and software will Simply Connect be compatible with non-medical services? For example, we are a social service agency providing home-based and office-based care. Would they be able to use Simply Connect in those arenas?
Yeah, that's actually great. So welcome, everyone. My name is Craig, and the CEO for Simply Connect. And actually, what happens with Simply Connect and is a patient-centered care approach. It actually rides above most, if not all, the electronic health records that you would use in that arena. And so by having open APIs, you essentially can connect into those systems that would offer the data to flow up. And then you have the ability to have a true kind of a patient-centered approach, which is like a patient dashboard. So you can be able to use the system either for the communications, like Cassia is doing. You can also use it for like a care flow management that Northern Cal is using it for, or also for the assessment service plan approach that Amanda mentioned and how she's using it. So it is very universal with how you would connect into other applications. And Amanda, I don't know if you want to touch on that. That'd be another aspect of that, but that's probably one of the best things I think you could be doing is maybe entering in and pulling in other data sets or partners. It's a very universal platform to partner with APIs, and we have quite a few of those already coded.
Right, I would agree with that. As long as you know exactly what you're looking for to collect, working with Craig and his team, and then, as he said, building that relationship with whatever end user system, and being able to have that interface.
Yeah, absolutely. Well, thank you. And what we can do is essentially first of all, I'd like to appreciate, say thank you to the team. I mean, although we've been working with LSA, and thanks to Charlotte and Alicia and Susan and Liz, and at the same time with the folks presenting, we've been working on this for anywhere from a year, with Amanda's for up to 3 years to really perfect a true care management platform. This is service coordination is another good word that you could be used. Patient-centered care, integrated healthcare, and what we really kind of pivoted to was paperless healthcare. So because we noticed that with the education that's coming in from Charlotte, Alicia, and the team was just focus on the staffing and efficiency and workforce management. So by bringing in paperless into the realm, we essentially recreate all the paper that's in the system. We digitize it, and by digitizing it, put it onto a team care, you can essentially then put that into an e-sign workflow. And then from there, you still can print it. So anytime you want to print it, but then what we noticed in the model was that by having the power of attorney actually put in there, that became extremely important, because that's really what's busted, in my opinion, in healthcare, along with a lot of things, was just having the ability to seamlessly communicate to the power of attorney. So by doing that, I think you can see the aspect of how Amanda, you did a great job of really perfecting that patient-centered the satisfaction scores, and I think that was a really good outcome that I love to see through the model. And then by also coming in and really coding the voice, the video, the text, and the push to talk, just the whole communications platform and how you communicate with no phone, no paper, no fax. So it becomes a truly light-footed model, and eventually with the staffing and efficiencies, that's what I think the teams have done a great job of perfecting. So, but as we look at the aspects of the importance of building trust, I mean, what we have to do is essentially build collectively together. And you start off with maybe a communications model. what we're going to offer essentially is an offer to everyone on the call today is a free offer to work with a true care team with text and communications platform. So this would be essentially an opportunity for everyone to take advantage of the staffing crisis that we really have at hand and really perfect this at no cost. Just ability for you to use it in the same way that others have used it. But it would really be the first part of the whole tile workflow of the consent management, building a patient dashboard, offering a team care approach, building a small team care, offering the communications to go with that. And then we could even offer the aspects of a workflow for documents and e-sign and be able to put in a whole workflow where you would be truly paperless on the first level. At the same time, we could even come in for medication management because we do have a clinical pharmacist team that will meet and greet the family up front. If there's a nursing shortage, a lot of times there's about a half a day brought into that reconciliation of the medication process. So there's that aspect of a professional services. So that's really what the offer is that here we want to help you and we want to allow everyone on the call here to leave with something that you can go back to your team on and truly have this up and running within probably 72 hours. So by doing that, we actually get a way for Simply Connect to work with you like we did with the other groups, establish a basis of understanding, figure out what your goals are, and then see really how do you want to apply the model. Because it is a wide model. You saw it today with every one of the three groups here. They use it in different formats, but in this, what I call really free pilot freemium offer is just a way for you to engage the family and really have you work with your staff to be more efficient and really perfect how you would actually communicate on team care. So I'd like to thank everybody for coming in. This is a great opportunity and for the platform for LSA and also for our speakers. And we hope that this will be something that you would take up for us. And there is a landing page we can get you to so you can land and or you feel free to call the team over at LSA. They'd be more than happy to help you out.
There were a few more questions. That was great, Craig. I'm sorry. Were there a few questions in the chat that we needed to cover? I know we got the question from Christy about making sure that it works in other types of settings, which I believe we answered that.
Yeah, we got all the questions in the chat, and I just want to make sure that people go to simplyconnect.me/LSA to learn more. That's simplyconnect.me/LSA. That's where you can go and share the information with your team who were not able to attend today. And you can get that information right there, share it with them, set up the 6-month free trial with the team care plus the text that Craig is offering today, and try it out and see how it works and how it's going to make things more efficient for your staff. And it's also going to help the families that you serve.
Yeah, we look forward to working with everybody. And Shaletta, thanks for everything you've done and the opening and for everyone's help here. And I think that if there's any other questions too for us at Simply Connect, feel free to reach out. I know that we're here to answer and start a dialogue, and we can help you get established on the team care and text right away. So to that end, if we would, I don't know if maybe hand this back to Charlotte or.
Yeah, thank you. Thank you so much to our panelists today, our member CEOs, in particular, Dave, Brenda, Kate, Amanda. Thank you for being the pioneers, for all of the work that you've done the past couple of years working on this. We really appreciate your sharing all of the barriers, the challenges, but also the opportunities in the way that you've been able to improve your workforce productivity and client service and expand revenue. I also wanted to thank Shalita for being a wonderful moderator today. And of course, Craig Patnoid and his team for Simply Connect, who's been a terrific partner for us. You will see in the chat that the Simply Connect website to go to find out additional information. I did want to mention that our Strength and Service series will be continuing and it should be put in the chat in a few minutes. We have a great slate coming up from Cyber Ready. Is your organization prepared for a cyber attack? Which sounds very dangerous, on July 13th. And then we have another session on moving from ally to accomplice, what it takes to do real diversity work, which will be on July 20th. So afterwards, you will receive an email from Susan Newton, who will be providing the recording for the session along with the PowerPoint slides. And please feel free, and you'll also be receiving a survey that we ask you to follow up with and comment on. So again, thank you for your attention and have a great rest of the afternoon.